Guys, it's Tea Talk Tuesday. I'm Danielle Robinson, board certified pediatric dentist. Today is going to be the last day in our trauma series, unless you guys have more questions. We're going to talk about how we monitor these traumatized teeth over the long haul. So for permanent teeth that either got repositioned or reimplanted, like I mentioned last week, typically we keep a splint on for about 14 days. Depending on the nature of the injury, we're usually referring to the endodontist, which is the root canal specialist, to start monitoring whether these teeth survived as far as is the nerve still alive on the inside of the tooth. And if and when the nerve goes downhill, we go ahead and let them do the root canal on the tooth to keep the tooth in the mouth, even though the nerve is no longer alive. Sometimes the injury is not as bad. We're monitoring over the long haul of, whether or not these teeth need a root canal or not. It may not happen immediately. It may happen several years down the road. So that is permanent teeth. Baby teeth have usually a kind of better prognosis as far as keeping the tooth in, because we don't have to keep it for very long. Permanent teeth are forever and baby teeth are not. So that gives us a little leeway. We only need to keep it for a few more years. If we can just hold it in there and it fall out naturally, that is the win. So the most common thing that I'm talking about on baby teeth in the event of a trauma to a parent about what can happen is what I call color change. So there's two different kinds of color change. So early color change is whenever the tooth turns dark or gray early on after the trauma. So I usually say about 3 to 4 weeks after the trauma, you might notice that the tooth all of a sudden turned really dark, kind of grayish, or sometimes it even almost looks purple or black. That occurs because the tooth has 3 layers. So the outside layer is enamel. Everybody thinks that's pretty white. In actuality, it's almost see-through, like frosted glass. It's white, but you can see what's happening behind it. So that's the outside layer of the tooth. The second layer of the tooth is called dentin. Dentin is yellowish in color, and it is microscopic tubules radiating towards the enamel layer from the innermost layer, which is the pulp, or where the nerve and the blood supply live. So in the event of an injury, tooth gets knocked, soft tissue usually has some swelling to it. Well, in the case of a tooth, there's swelling that happens in a closed space. The swelling has to go somewhere. So it will send blood into those microscopic tubules of the dentin that's radiating towards the enamel. After a few days of that blood being in those tubules, it turns into like a nosebleed situation, to where if you blow your nose a couple days or sneeze a couple days after you've had a nosebleed, black stuff comes out of your nose. Well, that's just dried blood. So the same thing that happens in the tooth and the dentinal tubules, that dried blood turns really dark or black. And because the enamel is like frosted glass, you can see that darkness showing through that enamel. So that is what we can attribute that darkness early on after the trauma, again, about 3 or 4 weeks. The good news is that the body typically, if that is the nature of that darkness, the body can typically clear that out. And so it cleans it out. You'll notice that it all of a sudden, after a little while, weeks usually, it will go back to a normal color. However, as a normal response to the trauma, on the inside of the pulp, the innermost layer of the tooth, it will lay down more dentin. Remember, dentin is yellow, and so if you're laying down a thicker layer of dentin that is yellow, we typically see that show through our frosted glass enamel. So all of a sudden we go from gray back to normal color to more yellow, and that's usually where it stays. So early color change doesn't necessarily mean nerve death. It just means that's kind of the normal inflammatory process post-trauma. So the second type of color change that I usually am telling parents about is late color change. Late color change usually happens about 3 to 4 months after the trauma, and that is usually nerve death, where the nerve is no longer alive in the tooth. Kids, as we know, are way more resilient, and their bodies and immune systems are way more resilient than we are as adults. So typically, if the nerve dies because of a trauma process as opposed to a bacterial process, which would be like a cavity, a lot of times the kid's body can just ignore it, pretend it's not happening. I don't care that the nerve died. We're just at some point gonna resorb the roots away so the permanent tooth can come in, but we don't have to worry about doing any treatment on the tooth like an extraction, which is really cool. So even if we do have late color change and that's the only symptom, we still are not treating this tooth. The worst thing that can happen is that if we have late color change and then we start seeing some sort of gum pimple indicating that the tooth is infected or abscessed, then we do need to go ahead and remove the tooth. So those symptoms would be a gum pimple. It's just like a pus pocket above the tooth, or the whole lip can swell, any sort of swelling on the inside of the gums after we've healed from the original trauma of the tooth, a fever of unexplained origin. We don't have any sort of ear infection. There's nothing else going on that indicates we are sick, and we probably are running a fever because of that. And then just sensitivity. All of a sudden, the kid, again, after the initial trauma was fine, and all of a sudden now we're no longer fine. That's usually an indication that we're starting to abscess and the tooth needs to be removed at that point. So that's a short synopsis of the things that can happen after trauma. So if you'll have any questions about that or want to have any more discussions about trauma, I'm happy to talk about it. Or if you have any other questions that you want me to talk about on Tooth Talk Tuesdays in the coming weeks, please let us know. We'll see you guys next time.